Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Nita, you're looking more beautiful than ever today.
Why, thank you. It's because we laugh a lot on this show, that's why.
It does help, doesn't it?
It does help. So we do want to tell our listeners they can call all hour and get a free book. 866-870-5752 is the number right here in the studio. And you get Dr. Darrow's latest book for free when you phone the program today. It's called Stem Cell and Platelet Therapy. Regenerate, Don't Operate is the byline. It has 264 scientific studies, and the foreword was written by Suzanne Summers, who has you in her book, A New Way to Age. I even know the page numbers.
What are the page numbers? Boy, this is a big, thick book she wrote.
I know, page 302 to page 316.
Wonderful. Thank you, Suzanne.
Yeah.
Thanks for bringing natural medicine to the forefront with your long, hard years of work doing this. And all of us docs that like to do things naturally really love you a lot. So you're helping a lot of people.
Absolutely. So you can also check out the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. What do you think?
I love it. I do a lot of work on that website every day.
I know. I check
There's
it
more.
like every week, and it's like there's something new all the time.
I know it.
But that's good. You keep it current.
Yeah, there's a lot to talk about today, and it all has to do with how to end pain in your body that comes from orthopedic injuries or arthritis. Luckily, I'm going to say for everybody else and me, my injuries were healed with using platelets, stem cells, and other things that we call regenerative medicine. And it's called that because we actually grow tissue. And when I was in med school, I was talking about this, and I was laughed out. I was talking about, doing things naturally. And in med school, you're taught basically how to use medication and surgery in orthopedics and physical therapy, which can be a great thing too. But it didn't get to the crux of how to heal. And in my personal opinion, surgery can be a great thing if done for the right thing. And most of the times in orthopedics, in my opinion, there are way too many surgeries being done that hurt people. And I'm going to guess from what I see with my patients, half of the surgeries seem to work for a while and half of them fail miserably. So I typically will send my patients who have terrible things to an orthopedic surgeon for a consult, a second opinion, because I want my patients to have informed consent. That means that they get to choose what they're going to do, and they learn all about different techniques in medicine. They get to decide what they're going to do. But what I get back from the orthos is they need surgery. And then we don't do surgery, we do injections with cells from the person's body and heal them up. And the ortho says that couldn't work. Well, it does work. And I've been doing this work since actually the late 90s, so that's quite a long time. And I experimented first on my own body and had great success with my wrist and then my shoulder. And later down the pike, I had to do my knees and my other shoulder. I first did my right shoulder, then my left shoulder. And my elbows, I've had other docs do my neck and back for me because I can do the front of my body easily, but I can't see back there. That would be kind of dangerous.
Duh.
Yeah. But I did do your neck, Nita. You had some great
Yes.
success with that.
I did.
And how long has it been since you've been feeling good from the regenerative medicine I did on you? I know I haven't seen you in the office for a long, long, long time.
Well, the treatments were actually, the first one was about 16 years ago, and then about 4 years later, so it's been about 12 years.
So that's when you were 16 years old.
Correct. What a coincidence.
No wonder you look so good.
Yeah, right? I'm going backwards.
Like Benjamin Button.
That's right.
Did you see that movie? It was a good one.
Long time ago.
I love Brad Pitt.
That was. So before you start trying to quiz me on jokes that I miss and feel like an idiot, I just wanted to invite the listener to call in again and rescue me from this abuse at 866-870-5752, right here in the studio, 866-870-5752. You can speak directly with Dr. Darrow about your musculoskeletal pain. It's a bargain.
It's a great way to go, and it's certainly a lot simpler than getting a surgery that has all kinds of potential side effects. I've seen some terrible things when I was doing orthopedic surgery in the old days, and I had a bad experience myself when I was in med school, as all you listeners who are regulars know. I hurt my shoulder weightlifting, just stretching it out too much, and I ended up, because I was doing orthopedic surgery, my boss, my professor, operated on it, and I'm going to say kind of wrecked it for a few years until I learned about regenerative medicine. Then I injected myself. I was 100% completely better, full range of motion, no pain, the very next morning, about 12 hours later. So it can work great. It's not going to work on everybody. I have to pick the right patients for it. And then the patients have to listen to me, because a lot of patients don't listen. They come back and go, how come it didn't work? Well, it was working. We know it grows tissue. There's been biopsies done before and after that show granulation tissue by day 3 after the injection. That's new tissue growth. And I've seen several MRIs and X-rays afterwards where we see the joint space increase, meaning there's new cartilage growth. But a lot of people don't listen to me. They are too active. They don't want to rest after an injection. And I tell them, well, you're going to rest after you have surgery. Why wouldn't you rest after you get these injections? And the reason is because after surgery it hurts so bad. After these injections, you can walk out and do what you want to do. Some people, besides being too active, take anti-inflammatory medicines, which block healing. They block the regeneration of tissue. Things like ibuprofen and others, there's hundreds of them. Another thing is a lot of people get a treatment, they come back and go, it didn't work. And I tell them sometimes it takes a few treatments to grow enough tissue so you feel better. So another reason is I use an ultrasound to look inside the body and guide the needle into the exact spot. And most docs do not do that. So if you're going to get an injection in the body, in the joints, ligaments, tendons, make sure you go to someone who's been trained in ultrasound. Because if you miss the spot, it's not going to do much good. And the studies show, for example, if you get what we call a blind injection into the knee, blind meaning no ultrasound guidance, the chance of missing the joint are 33%. That means 1/3 of those injections are not going to work. So
Wow, that's a lot.
it's a lot, yeah. And a lot of times people get steroid injections, cortisone, which makes them feel better right away, but a lot of them don't work at all. And I'm not a proponent of that stuff. There are rare times when I use it. If someone comes in the office all bent over because they have low back pain, then I might do some steroid injections into the ligaments and low back, and pretty amazing because they'll stand up in 2 minutes and pain is gone. But that's not a long-term cure. What I'll do with them is I'll have them come back in a week and then start regenerative medicine to actually heal the ligaments, tendons, whatever it is. And we should be careful not to inject into the joints because that cartilage gets worn down by putting steroids in there. Steroids meaning like prednisone and things like that, cortisone. ONE means steroid at the end of the word, at the end of the medicine. So, Nita, I think it's time for a little punishment for you to get the show rocking and rolling.
I figured. It's okay. I'm ready.
Can you take it? You're 16. You're pretty old. All right, Nita, here we go. Why can't you trust duck doctors?
Because they just are quacks.
You got it, baby. That's $1 million in your pocket today.
All right.
Nita, you're a genius.
Thank you.
How did you know? Did you look at my questions ahead of time?
No, I didn't. Okay. I just don't even know where you hide them.
That's a terrible story. I was getting my first course in physics was in pre-med, and I hadn't had it in high school or college. I went back to doing pre-med when I was about 40 to do medical school late in life. And I got a D and a C in my first physics class.
Oops.
And I thought, there goes my medical career. And I had a deal with the dean of admissions that if I got straight A's in pre-med, that I was immediately into medical school. So I worked hard, but I'd never had physics before. And it was tough. It was during the summer. There was a test every week, and I didn't know how to do it. So I talked to my niece, Denny, who was also late in life going to go to med school. And I said, I'm in trouble. What do I do with physics? She said, don't try to understand physics. Memorize the formulas and plug them into the problems. After that, I got 100 on every exam.
Wow.
And the professor gave me a B. But the B, the number on it was like 1 point below all the other A's. So I went in to beg for that A because I needed all A's to get into med school. And he said, you better leave because you broke into my computer and stole my exams. No one's ever gotten 100 on my exams before.
What?
Yep. So I left very dejectedly, had a little nervous breakdown, you might say, called the dean of admissions and said, hey, I got a B. What's going to happen? He goes, well, I've been watching you. You've gotten A's in all your other courses, so don't worry, you're going to get in. Forget that guy. He's a jerk.
Oh, how could he even do that? That was so awful.
He was taking a lot of Xanax, he admitted. He was depressed.
Goodness.
All right, so let me get to a question here and jazz up the show a bit, okay?
I would have testified for you that you're not a computer guy, by the way.
I wouldn't know how to break. I can hardly break into my computer, let alone someone
with all
else's.
the passwords.
Yeah, exactly. All right, so someone writes in, sudden and progressive hip pain, International Mountain Guide. Let's see what that means. The person says, I found this article very interesting, having had osteoarthritis diagnosed with an MRI in the right hip, which shows it as being significant. The pain and stiffness came on so suddenly over a 2-week period from being very active to reducing my fitness regime significantly. I know sooner rather than later I will require a hip operation. Well, that's an error in thinking, Nita. That is not true. But I am that person you mentioned that wants to climb a few mountains in 2022 as my job as a mountain guide, and one quality final year guiding would be fantastic. PRP injection would be my delaying tactic prior to an operation. That's error in thinking also, because I don't do this to delay surgery. I do it to eradicate the need for surgery. If there are any trials going on, I would really be interested in getting involved. Kilimanjaro in July would be my target for my 14th time on the summit. Wow. And then he says regards and gives his name, which I'll keep private here. So I wrote back immediately, and then let's see what he says after that. He says, thank you, Dr. Darrow, for your quick response. And by the way, everybody listening, if you go to my website, www.lastemcells.com, there is a spot on every page where you can email me. I hope you're not too shy to call into the show, but if you are, you can always get to me through the website. And I answer those emails every day. I get emails from early morning till late night and in the middle of the night, and I answer them every day. So that's a great way to get a hold of me and get a direct response. But if you want to talk to me now, why not? Call me at 866-870-5752. That's at the studio, 866-870-5752. And if you want to catch me at the office, the number there is 800-300-9300. Let me get back to this gentleman. He said, I did have swollen knee joints in 2020 and took prednisone, for which took the swelling down. That's a steroid shot. And I returned to normal cycling and walking, and this followed a fall I had on my bike at very slow speed. So this was trauma-induced. I was fine then until August that year, and the pain came back swiftly within a week after a pleasurable walking holiday here in the United Kingdom. By the way, we do have a lot of people that come in from the United Kingdom, from all countries, from all states, and they usually will stay with me for several days and get several injections in a row. And that's another question that we get, Nita. How often do you do these treatments?
Right.
And as people know who know me, when I blew my knee out a couple years ago, I had 45 cc's of fluid, which I saw on my ultrasound, which freaked me out. And I did stem cells on my own knee 4 times in 1 week. And I will go out and play golf today, and I'm going to feel great. My knees are good, my shoulders are good, my wrist is good, my neck and back are good. So this stuff has worked well on me. In terms of pain management, I am on 8 tramadol and 3 naproxen a day. Oh, and once a week, 12 milligrams of methotrexate. Not good. If the PRP injection worked, I would love to come off all drugs. I hate taking them, but just need them to get to sleep and be able to function the next day. Well, this person is an over-exerciser, which I also am, so I understand the syndrome. You know, we are addicted to something that's good in a way and something that hurts the body. And I've had good luck with all these injections I've done on myself, and I think this person can also. Interesting thing is the person said they had arthritis in the right hip, which came on over a 2-week period. What does that tell you, Nita? I'm going to put on your thinking cap for you and let me know if you can think of a reason why that happened.
Okay.
Was it from the arthritis or overuse?
I think overuse.
You got it, baby. Bingo! That's $2 million in your pocket today.
I'm doing great. Thank you.
So yeah, arthritis comes on slowly, okay? It's not something that pops up in 2 weeks. So does that mean the arthritis was the problem? Absolutely not. I get people coming all the time that have arthritis that don't have pain. And there's studies that you can read on my website or in my book, which we're going to give you for free if you want to call in. It's a $25 book, but if you call in right now, you get a free copy, and we'll mail it out to you for free. And that number to call me right now at the studio, because I want to talk to you, is 866-870-5752. So write that down. If you miss the show, with us live on it, sometimes they play the show at other times when it's not live. You can always call at the office to get more information, and the number to the office is 800-300-9300. That's 800-300-9300. This book is amazing. It has how many studies, Nita? 256?
264, actually.
Oops. A lot of studies that show why you should be using regenerative medicine, stem cells, and platelets instead of doing surgery. Now, I'm not putting down surgeons. I love surgeons. If you break a bone, where do you need to go? To the surgeon right away. But if you have a meniscal tear in your knee, ACL rupture, labral tear in the shoulder, hip, that's not something that I would recommend surgery for. I've had endless people with ACL ruptures. I take the blood out immediately using the ultrasound, so I get every drop, and they heal right up unless that knee is loose, which most ACL ruptures do not give a loose knee. They can keep doing their sport. So why get a surgery you do not need? I had one on my shoulder I did not need, and it made it a lot worse. So be careful. All right, Nita, punishment time. You ready?
I am ready.
I'm so bad. All right, Nita. What do you do with a sick boat?
Rocket.
Well, how's that going to get it unsick? How's it going to heal it?
Because it will soothe it. Just, rocking motion.
I
It
wanna
helps
heal
babies.
it.
It helps babies.
What do you do with the sick boat? You take it to the dock.
Oh, that's a good one.
But you're not laughing, so I got to give you one more until you laugh. All right, I know you'll laugh with this one. Why don't they play poker in the jungle, Nita?
They don't play poker in the jungle because there's not enough chips.
Too many cheetahs.
Ooh. That's a good one.
There you go.
That's
See, I've got you reinforced now that if you don't laugh, you get another joke.
Okay, I got it.
You got it. All right, we're going to go to, let me see this one. Okay, what does it say? Worst pain after knee surgery. Yuck. I had knee surgery, removed 50% of my meniscus. Yuck on that one. And in November, still having more pain than I did before the surgery. Had 2 blood clots in the back of my knee now, and the middle of my knee is killing me. I didn't know if the doctor did me right or not. I was taking medication for inflammation and seemed to help, but now I have to be on blood thinners, so I can't take the other medications. I think this person wrote me again because this seems familiar. But I'm going to go over it again in case this person didn't hear the show. So I don't like when people take things out of joints. That's good cushion tissue. And I have people all the time that come in. Every single day, actually, I treat people with meniscal tears in the knee, rotator cuffs in the shoulders, and a lot of them get better. Most of them get better. So I didn't do surgery. All I did was inject some of their own cells, some platelets or stem cells into them, and they did great. So why take out tissue from part of the body when it's going to destabilize that joint? It makes no sense to me. I had that shoulder surgery, and they shaved down my acromion, which is the bone on top of the shoulder, cut some ligaments, and I came out terrible. I lucked out, though. I discovered this type of medicine. I injected myself. That was back in the late 90s. And as I always tell people on the show, I'm going to go play golf today. I'm doing good. Probably lift some weights, go for a run. I got to live it up doing sports. And I know a lot of you are just like me. So give me a call right now if you can. Number here, 866-870-5752. So I'm going to go to another question here. Okay, let's see here. Pain shooting down my back and into my left leg. Doesn't sound fun. I have pain shooting down my back and into my left leg, affecting my knee, making it very painful and stiff and unable to walk. Well, a lot of issues there. One is the pain shooting down the back may have nothing to do with the leg pain, or it may. And that's something we have to figure out. And one way we find out is by doing a very thorough examination and seeing if there's any kind of tenderness or problem moving that leg around. If there is, it probably is not coming from the back. If it comes from the back, we call that a radiculopathy, which means the little nerve coming out from the spinal cord is being impacted, what people generically call a pinched nerve. Could be from a herniated disc, it could be from the facets that are arthritic that cover over the foramen, which are the holes that the nerves come through. So that's one that we have to be careful not to just operate on right away, because it may not be a problem. It may be something where the knee is the problem or the hamstrings are the problem. Hang with us. We're going to go to the break. And Nita, take it from here. We love you, folks.
We certainly do. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.